UCLIC was created to help students have a different experience with clerkship.
There's one word that I would link UCLIC to, it's continuity.
I love the rural experience.
My preceptors are awesome.
It's the most fun style of medicine that you can do.
I had moments with patients that finally made me feel like I was doing the right thing with my life.
This is about creating great doctors.
One of the best things about UCLIC is continuity of care and getting to follow your patients along from the first diagnosis through their management to their follow-up.
I could see someone in the emergency room. I could follow up with them in the family clinic and see how things are going. And I think that really helped solidify some of my clinical knowledge.
And so that's a big difference from the rotation-based clerkship where there's a different physician doing each of those things, and so you may not be involved with that patient's follow-up care, where you're more likely to do that here.
The fact that I've been able to follow the patients has made my learning even better. If I meet the patient, I learn their story, and then I see them a couple more times, I remember how we treated them and how they did on that treatment, and it sticks with me more.
Even in my first month here, I had patients that I knew quite well and who were bringing me pickles and jars of honey and that sort of thing, just because you get to know them so well.
Patients were very open and accepting of having a learner in their site, especially someone who was willing to move there for a year to become part of their community.
Well, not only a fluid thing, but it's a hormonal thing. Think of all the stuff that we do.
So on top of continuity of care, I think one of the big benefits of UCLIC is that you develop a relationship with your preceptors.
I like the long-term relationships that you get to form. I tell them how jealous I am of the program that they're doing, and I wish that this had existed when I went through my training.
The type of medicine that we're able to do in a rural setting is significantly different than what can be done in an urban setting.
Here, you're going to see the appendicitis, you're going to see the bowel obstructions, you're going to see the cancers.
Anesthesia, surgery, cardiac stress testing, scoping, and so it really feels like you're practicing as a real doc.
Because there aren't as many medical students here, our students are first in line when it comes to procedures.
Both Dr. Gelber and Dr. Parker are GP anesthetists, and so when we're in the OR, both Kirsten and I can do spinals because they've been the ones that taught us how to do them in the first place. They've seen us do it before. They're quite comfortable with that.
They trust me. They know me well enough to know what my strengths are and my weaknesses.
And so I completely trust it when they go to the emergency department and they tell me that they've assessed someone and these are the findings that they've got.
I think our students really get a great idea of how the healthcare system works and how to effectively navigate patients through it.
That's the stuff that doesn't really come up unless you see it happen in front of you, and that's when these conversations happen, and that's the value of having a longitudinal experience with your preceptor.
And I can tell you by the end, they're almost like a junior partner by that point. We trust their judgment, we trust their assessment skills. Their logbooks are usually full in the first 6 weeks or 8 weeks.
The role of the preceptor is inherent. It's one of the backbones of UCLIC, and without the great preceptors, UCLIC just wouldn't be the success that it is.
I like being a clinical teacher, but I really like being a preceptor.
A typical week in UCLIC is perfectly atypical.
Monday I do emerge.
A few days of family med clinic.
One day is usually spent in Carson, the other day is spent in standoff.
Wednesday I'd maybe do anesthesia.
We'll either be on the anesthesia side or on the surgery side, or sometimes we'll get to do both.
Oftentimes perform the anesthesia and then scrub in with the surgeon as well.
Doing some Indigenous on Reserve family medicine, which is something I'm very passionate about.
Try and build in at least one kind of 24-hour obstetrics call shift into my week.
Friday morning would be family again.
And one evening a week and one weekend a month I would be on call.
And then I do home visits as well.
Typical week was really what I made out of it, and I think that's the most valuable part.
One of the challenges for the program is that you are somewhat far removed geographically from the rest of your classmates. What that gets replaced with, however, is they really become part of our family here.
The staff is so helpful. Like, I think the first week I was here, I went to like 4 different dinners.
Dr. Parker, he runs a judo club, so he's always trying to get us to come to drop in and learn a little bit of judo.
And you are also just taken into this community, and a lot of people embrace that you're there and they know you're the medical student and they invite you to different events.
But the thing I think that's really special about UCLIC is the camaraderie as well. I know every person in the UCLIC program. I know them by name.
We have to go back to Calgary for some of our rotations. It's really nice to come back to a place where everybody knows you and you know everyone. That really, I think, adds a lot to the clerkship.
So they really become part of the fabric of the community, which I think is a great introduction to the idea of being a rural family doctor and how being part of the community doesn't end at our clinic doors.
One of the things that I feel is the best about UCLIC is when asking for someone to write a letter of support for me in application for residency program, I really felt they knew who I was, they knew what I could do.
Not only have I written the letters, but I found out what programs they're most interested in, and I know the program directors, and I phone them. I say, look, I know you have my letter, but I want you to let you know about this person and why you want them in your residency program.
I've had 2 emerge shifts a week. If I was applying to an emergency medicine program, the quality of the letter that I would have gotten would have been lights out compared to what I could have gotten from someone who I had worked with for a week or 2.
Well, even though I matched to a specialty, because of my rural experience, I recognize that there are a lot of people that would benefit from some specialist services, more so if they were offered closer to home.
Well, fundamentally, I believe medicine is a service profession. So I think that we should be having students come into our med school that are focused on servicing humanity and going where people need you. And we need people in rural Alberta.
I was doing a rural rotation as part of my training, and after just 4 days of being out in a rural site, it really reopened my eyes to what I had forgotten was the reasons that I went into medicine. It's a decision that I'm proud to have made.
UCLIC was great. It really prepared me for what I want to do after I finish residency, which is practice in a place like Winter Creek as a rural family physician.
Unless there's something specific that's tying you to staying in Calgary, it's a no-brainer.
So whether you are for sure going to go rural, whether you are not sure what you want to do, or whether you just want to become a really good doctor, UCLIC is the way to go.